Medicare doesn't cover all of our healthcare expenses, and what it doesn't cover can cost us hundreds or even thousands of dollars every year, even if we don't have any major healthcare issues. Because we are still responsible for Medicare deductibles and Medicare co-payments, in addition to fees or charges by doctors and hospitals that exceed the standard Medicare allowances, as well as benefit limitations and coverage exclusions like prescription drugs, dentistry, vision care, hearing aids, routine checkups, most immunizations, and custodial or recovery care, even when it's required after surgery or hospitalization for a serious injury or major illness like cancer, stroke, or heart attack. And Medicare expects us to pay for all these expenses out of our retirement income or our retirement savings. So, how can we get coverage to pay for these healthcare expenses? With Medicare Advantage, also known as Medicare Part C. Medicare Advantage is private health insurance sanctioned by Medicare to provide all of your Medicare coverage for both hospital and medical benefits, plus some provisions that Medicare doesn't cover. But with a Medicare Advantage plan, you can also get lower deductibles or co-payments, as well as higher limits and additional coverage, which can save you hundreds or even thousands of dollars every year. Here's how it works. Medicare enters into annual contracts with insurance companies to offer Medicare Advantage plans in specific geographic areas. Medicare then pays the insurance company to provide the coverage for both your hospital and medical services. However, each insurance company can structure its Medicare Advantage plan with different deductibles and different co-payments, or even different coverage provisions, as well as certain restrictions that may require you to receive all elective, non-emergency services within a network of doctors and hospitals. And Medicare charges most of us for our Part B coverage, our medical benefits. So with a Medicare Advantage plan, you must still pay your Part B monthly fee, plus any fee for your Medicare Advantage plan. And while some Medicare Advantage plans do not charge any fee, those plans that do charge a fee usually have lower co-payments or provide additional benefits, and the cost of those plans will usually vary, depending on where you live and the plan you select. What's more, Medicare negotiates contracts with Medicare Advantage plans every year, so your plan provisions can change each year, or even be discontinued in your state or county. And if your plan is discontinued, you can either enroll in a different Medicare Advantage plan or simply switch to Original Medicare. It's also important to know that a Medicare Advantage policy can only cover one person. So, if you and your spouse both want coverage, you will need to apply for two separate policies. Making sense of Medicare provisions, limitations, and exclusions can be complicated, and understanding the pros and cons of Medicare Advantage plans can be confusing. What's more, there are other important considerations concerning your Medicare options that can affect the cost of your health care, especially if either you or your spouse will have insurance through an employer. Which is why you should meet with a qualified Medicare Advantage insurance specialist who can explain your choices and compare your options for you, including the cost of each plan available in your state.